So we're going to begin. It is 2:33 p.m. on Monday, October 21st, 2024. Welcome to the City of Norwich Health Equity Committee meeting. So I will call us to order and we will do attendance by roll call. I'll call off my screen. Kathy Special.
Here.
Dr. McLean.
Here.
Patrick McCormick.
Here.
Melissa Myers.
Here.
Laura Dietrich.
Laura Dietrich.
Joe Zuzel is present and Kate Mildy. Perfect. Citizen comments, seeing as there are no citizens present, we will move forward to our next agenda item, which is approval of the minutes. Everyone got to see minutes as submitted. Were there any questions, edits?
I don't think I got them. When were they sent? This is the minutes of the September meeting?
Yeah, the agenda and minutes went out, I think last week. Sheila sent them.
I didn't see minutes attached to it. I saw
Maybe it was just an agenda then.
it was just the agenda.
Sent them to the clerk's office? I don't.
Yeah, it just had the original orders by the council attached.
Right.
Okay, so they went to the clerk, but it didn't get out to committee members. So we'll make a note to change that and make sure that you get a copy of the minutes. So my bad on that.
Do you need me to pull them up?
They're on the city's website.
They are on the city's website. Well, I don't want to make a motion to approve if no one's seen them, so I think we'll just have to table
Okay.
that.
That work?
All right, so moving forward to updates, chair updates. So I will just say that medical mission is happening. Folks know about medical mission that's happening in the city of Norwich at NFA. Something that we do every year. I know we've canvassed to a lot of individuals on the call. It's just a really great opportunity for us to continue to push the health equity envelope for individuals who are unhoused, undocumented, underinsured, not insured. It's a great way to really serve the community and help with that. So if you know of individuals who are interested or are in need, it's a great day. And my thanks to many of you whom have already volunteered to help.
Sorry. We're having something happening in the hallway here. I don't know.
Quite a
if you
day
guys
at City
can
Hall.
hear
We've
it.
got early voting. We've got Zoom meetings on the haywire. Somebody is literally chopping down a wall outside, but it's okay. We're gonna keep rocking and rolling. So that's my updates. Don't really have anything else. So we'll move on. There is no guest speaker today, but as always, if individuals have opportunities for a guest speaker, please send them my way or feel free to reach out. Particularly when it comes to analyzing and synthesizing the data that we're all collecting, it might be nice to hear from someone who has a background in that to help kind of give us some guidance and overview of what we're trying to do with the health equity plan. So if anybody does have those kinds of individuals or contacts, please send them my way and I will reach out. And that brings us to the main points of the committee today, which is our subcommittee report out. And really what we're talking about is our questions. I did print out the most recent updated questions that thanks to Kathy, your folks, and the things that you put together, and also to Kate putting them together in a way that's a little bit more organized. I did email that out to everyone. So I think we'll just open up the floor and talk about questions in general. Do we have edits, additions? What are we thinking here?
I have a few thoughts.
Sure.
I still think, and this could just be because of where I work, but I still think we should provide resources. And maybe I need clarification still on what we're doing, because if we're putting out the questionnaire citywide, I still think it leans heavily large business and large organization as opposed to the smaller organizations who might struggle with some of these questions and not have some of the resources they're talking about. So I like to approach things like, okay, here's the survey, And maybe some of the questions get switched more to yes or no. If no, why not? And here's some resources that might help you. I just hate putting out a survey and not providing resources with it. You know what I mean? Because what are we doing with the information once it comes back to us? Is
Yeah,
it coming back to us?
So I think that's a great question. It really comes to about scale and scope.
Mhm.
So with this committee, basically what we're doing is we're not putting the survey out to all of Norwich, it's just the organizations that are represented on this committee. Because these were the ones that town council thought were best representations of healthcare disparities. Remember, we're talking about healthcare here. And, you know, working in the areas of equality within our populations and our programming and what we're doing about that. So we really have to like make sure that we're looking at a lens of individuals who were included in the original resolution, as well as our overall topic, which is healthcare disparities. And then basically what's happening is, you know, we were tasked by the city council, everything's popping up here. I don't even know what to do. We were tasked by the city council to be able to provide a data set, sort of an overview of opportunities and what we could, what was going on in Norwich. So our report will include, to your point, Kathy, some really great celebrations, but also some big opportunities that individually we as partners might want to work on just on our own. But ultimately, it's really up to the city council and the city of Norwich to look at some of these things and then put something into play. So it's sort of like two legs of the stool, right? So first, we have to get a level set playing ground of what is actually happening. So as the major representations of what's happening in the community, as far as community outreach, healthcare, access to services, equity, we need to be able to showcase and tell everyone what is actually happening. What does the playing field look like? And then we give that report to city council, and then city of Norwich and city council decide what to do with that information. So is it to hire an equity specialist for the city of Norwich to work within, you know, the city, but also all of our other organizations funded through, who knows, maybe cannabis dollars, in order to really unite and put everything together on that? It's just like off the top of my head, right? But those are opportunities that, you know, the city will be able to expand upon in terms of resources. Does that make sense in terms of our clarification? I mean, I know where you're coming from, but I think we have to work with like the first step first and then kind of see where it goes, because we don't have the power to tell the city of Norwich, like, here are these resources and this is what we should be doing, right? It's more of like us giving them the information for them to decide where they would like to go.
So are they gonna come back to us then? When the council decides and discusses, are they gonna come back to the Health Equity Committee to say, this is what we've determined and this is what we need your help with? Or
That's a great question. I mean, at the end of this report, the Health Equity Committee's work, as it was initially brought up and thought of, will be completed. So whether city council votes to continue with this committee and push it forward, to reimagine the committee, to create a different subcommittee, to implement some of these ideas, to use us as a task force or a consultant, that remains to be unseen. But we're just focused on that one overarching sort of goal and end of programming on that. And Kate, please feel free to jump in if you have any other sort
No,
of.
I think that was a really like comprehensive explanation of what we're trying to do here. Really, we've been tasked with developing best practices or suggestions or highlighting what works and what doesn't for the people already doing health equity work, which is the members of this committee. And then giving those suggestions, ideas, and holes in service, you know, highlighting that to council. And then it was always been our understanding that once that report is effectively delivered, then we can dissolve the committee as it exists now, because we've completed the mission. And city council will then have the data to do with what they wish.
I think that's what I'm struggling with. To do with what they wish. I like to complete the plan, and like, even if it's not the plan, it's, here are some resources you can use. Because I do think even we have some who organizations with us who are very patient oriented, health oriented, and then others who are not, you know, the schools, the library. So we're going to get different perspectives, which I think is good. But might be a little hard to,
Maybe there's like an appendix to the best practices report that lists those resources.
and
So
that's
maybe
what I'm
that's
looking for.
something-
Yes, like the
Yeah,
best
so maybe
practices
it's
has to be
not-
practices.
Yeah.
I mean, we could even say as a final section of this survey, what resources would you suggest city council uses in doing this work? That would be an easy way to incorporate it,
And I
either
think-
an appendix or a separate question, maybe.
Yeah, I agree. And I think like, that comes with the formulation of the actual report that we can't do until we ask the questions to get the data to put it together to see where we go. So, like in designing the report, I can definitely see like maybe there's a resource opportunity. Maybe there's a way to, for those organizations that aren't dealing directly with healthcare, there are equity questions that are still aligned in there in terms of professional development, HR, how we make our workplaces, friendly, how we're posting for jobs. There's a lot of things that go into an individual's overall health versus just their diagnosis and their prescriptions, right? And so like, I think just the report in itself, there can also be something in the intro to talk about health of the community, healthcare disparities, but also disparities in someone's overall health as well, to sort of highlight those organizations that aren't directly involved in healthcare, but I would argue have still like a value in that space as well. I mean, even in the schools, we look at school-based health centers, we look at, different epidemics and things that are happening.
Don't even know.
Is anyone there?
Our TV went off for a second. Can you hear and see us?
Yes,
We're here.
we can hear you and see you.
Friday the 13th at this place. I gotta get out of here.
It's just been a continuation of last week, I guess.
It's wild. The early voting is messing with our plans.
I'll tell you from our side though, not in your room, we can't hear anything. It sounds like you're just sitting there alone and there's not any side noise.
Really?
Yeah.
Okay.
Well,
Okay.
that's, at least there's that. Thanks for letting us know. We'll stress less.
Looking at Costco.
There's like construction happening.
So
Um,
Kathy, does that help to answer some of those questions? I'm sure other people had
does.
similar
No, it does.
context questions and ideas.
Yeah.
I'm also open to suggestions through all of this. I mean, like, this is not my plan, this is our plan. So like, if you have ideas like that to say like, we should have a resource section, or we should also discuss how many of us partner in some of these ideas, right? Like, how do we like work together? Like, I know that we have relationships with almost everyone on the call where we're doing initiatives or programming in the community that we're all work together with. And we can give examples of that also in the plan that go a little bit beyond what the questions look like to sort of join that together.
Yeah, no, it makes total sense to me because I was thinking that this survey would be shared more widely than just within our group. And we're seeing what people are needing. Like, we're talking to people who are trying to find jobs, and there are barriers there that like a master's is required
Right.
and they don't have their master's. And that's like part of the questions that our committee put together was, are those education requirements necessary? Is there in-house training that could happen instead or something like that? So that's kind of the lens I was looking through too, is we have people who are borrowing our phones because they have, they're on the phone with different medical organizations and they're struggling to communicate and they're trying to get their questions answered, and there's barriers there too.
Right.
So I was looking at it from the library's perspective and the patron's perspective. Like, what are they
Right.
struggling with? We see it.
Right.
Helping them with it.
Yeah, and I think like a lot of times we'll have, those individual needs. Like, so when we do our community health needs assessment, we talk about transportation, we talk about communication, we talk about chronic disease, we talk about food insecurity, so on and so forth. But in this way, City of Norwich has human services. They're aware of a lot of the things that are going on with some of those needs and the things that are happening. We are trying to figure out how health equity and healthcare disparities are represented and supported within organizations that work in these fields. And how do we lay the groundwork for best practices to be able to share, one, the great work that is going on in Norwich for not just business and government folks, but for the individuals in the community as well. But also, how do we say, out of like 10 out of the 14 organizations represented said they had specific training on LGBTQ plus rights and resources within the workplace. Therefore, we recommend within this plan that this is made available, right? 6 of those individuals said that it was mandatory, right? 5 said that it was a volunteer type of thing, right? How are we level setting what kind of practices we can promote that we're already doing? And also, maybe there's a way that we look at it and say, I didn't realize that 4 other people were doing that. Maybe that's something we can do. Maybe we'll call them, figure out who they used. Who's your consultant? How do we go? So it's more from that lens versus the individual lens of saying, fuel costs are too high. I can't get on a bus system. Public education, those are more the individual causes that we in our everyday are working on. We're trying to go a step back to say, like, what as an organization, as a city, as a town council, right? What are those practices that you can put in place that are already happening within established organizations that are in your community and already working together? Is that
Yep,
pretty on the
perfect.
money?
That's what.
We're recording this, right?
And I do like that too. I also like that we would have kind of a
I
universal
would say
plan.
this would fit
Right,
right
right.
into that. What we were dealing with is that there are gaps, and we just found one, and we have to figure out how to address it.
Right.
Okay, not done at the employee level, but at a higher
Exactly.
appointed level.
Exactly.
And you need to figure out how to address it,
Exactly.
which goes back to what you're saying is, if, and Bob has experience, so he could say in other communities,
Right.
this is how things were
Correct.
handled. That is what we need for those of you on the call. We need to know how other people have handled
Correct.
or not handled the
Right.
situation.
And why?
And
And would you, if you could, right? Like those are those kinds of things. Yeah, I agree.
We had a real valid reason why we were late. We were
It's a
doing
crazy
this-
place City Hall is today. I'm telling you, it's a crazy place. These are great questions, though. I'm happy to keep talking about this too. So, if individuals want to talk about the new questions that are sort of organized, if there's changes to it, did we like the old ones? Are the new ones a little bit more succinct, easier to answer? Because I'd like to leave the meeting today with us saying, yes, these are the questions. Get them to the folks within your organization so we can start getting that data to roll in. Because then we're going to have a big time putting all that information together.
When is the due date?
The due
Due date to have them back.
We
haven't
were gonna
said
talk about that
We need to
today,
pick
yeah.
that today for sure.
But, okay, so imagine, that plan that we're looking at, April is when our next report to the city council.
Right.
So the end of March, we have to prepare a report.
Correct.
And then if we're gonna go in front of the council during an April meeting.
Correct.
So that date from.
Yeah, so how much
the-
time?
February? What do you
Okay,
think?
you think that's, if we were to roll it out November 1?
Oh,
and
sorry.
then-
Sheila was saying, I'm sorry, Dr.
Oh,
Qureshi's
it's
coming in
too
too.
quiet.
So Sheila was saying that our next report that's due to the council is April. So we'd really like to be able to have the report done by April, which means that we would have to have the presentation done as well. And we would also need to bring our preliminary data and findings to other individuals before we bring it to the city council. So that being said, if we have February, like February 1st as our due date to have all the questions answered by your organization, not necessarily by you, but the people in your organization, and sent through that survey, then Kate and I can begin to sort of pick at some of that data, put things in some
Yeah,
buckets and
signed right
start
up for
working
that
on
one.
it.
Everybody heard that.
Could we
Just kidding.
back it up to the third or fourth week of January? I hate to give a February 1st.
Okay,
Because then you're always looking, it somehow falls into the next week.
Yeah.
Back it up a week before in January.
Melissa, I see your hands up.
Yeah, thanks. So how, when we are thinking we're gonna end with presenting data, how are we turning it into, kind of data analytics, quantitative kind of information? Because these questions are extremely, qualitative. I mean, I can say ourselves, we're daunted. This is going to be pages and pages of how we draft, because all of this stuff, every question we do. And so I'm going to have to go into lengthy detail about how we address some of these things. So it's going to be very, very lengthy narrative. So my question is, how does that then turn into a data report for them? Is it just gonna be drilled down to 10 out of 14 partners have a way to track hiring practices versus the actual, how would you sum up a whole bunch of narrative? I guess is just the boiled down question, because a lot of these are just gonna take a lot of narrative to answer. So how would it
Agreed.
get boiled down?
Agree. So I'm open to suggestions. One of the things that I'm thinking about is a lot of times when we do stakeholder interviews or focus groups, if anyone has ever done that, we have the recordings of that or we have the notes from that. And then based on, all of the answers, we go through it to say like, what are similar themes? What are some of the similar programs that are happening? Can we highlight one or two programs to illustrate the point in these categories? So really in direct services, it would be looking at those answers and saying, okay, what's similar? Are there outliers that need to be mentioned? And to your point, it's going to be mostly like quantitative, like running narrative. It will be much more of like a report that you would read. But my idea is that for certain slides, we may be able to pull out certain points to show, what this looks like. But that's just off the top of my head. I'm opening that to everyone who might have more experience.
I think that makes sense to have it like at a higher level. 10 of our 14 answered they do have this, and their varieties of this include and highlight, do a highlight reel for each subsection. So we could go through each question and say what the overall answers were, and then delineate the content more succinctly. And see what that turns up. I don't know.
Yeah, so I'm gonna ask you to help, since not all of it, but a majority of this, you're gonna have to have some important guidance in how the city is going to implement, address some of what this report is going to develop when it gets reported out. So there's the report that you give to the council, which to me is really high level. They're not going to sit there and want to know all of the information like Melissa was saying.
That's what I was concerned with.
Yeah, but the council's not going to want to know that. But Bob may say, okay, this would be helpful when I'm talking to the director of public works. That there are some, well, when I'm talking to his directors, plural, there are some opportunities that I could share with them that we could start talking about how to address and possibly implement. Okay, so I see it as two-tier. There's the overview report that gets presented to the council, but they understand that to the departments, to the city manager, to the HR, for the directors, that there's additional resources or information that has been collected, and that is available to them to then sit down and develop whatever plan for the city or whatever policies or however they want to start. Would that sound reasonable?
Yes, I think, I don't know if we're saying the same thing. I think if we're not, it's close. Whatever's presented to council, I would agree, probably on a high level is best. The departments need to have a customized message because all the departments are different. There's going to be some overlap and similarities in their needs, but somebody's going to have to identify, and that to me is a discussion by the director.
Right.
And somebody could be the director of HR and the director of public works or the director of health and human services about what it means or what it should mean for their department.
Right.
More customized message.
Right.
I think that's what you're
That's what I'm saying.
Yeah, I agree
Yes,
with that.
right.
Yeah.
So you're differentiating between like council policy level and director implementation level.
Right.
And the data will all be captured in the results of the survey, but only the policy level pieces can be delivered to council, little digestible parts.
Right.
Okay.
because the council's not gonna implement, I mean, they're not gonna implement. It's gonna be at the director level, from the city manager on down.
Right.
Okay, and let's face it, politically, this document should outlive, you know, the every 2-year cycle of what happens on the council. It shouldn't- and that's, I wanna take it out of the political arena,
Mm.
okay, and put it where it belongs, within the hands of the departments.
Other thoughts, ideas?
That's a great transition. I have to go get my
Okay.
kiddo to fencing, but
See you
they
soon.
over so we won't mess up
Oh, we
quorum.
got quorum still, we're
Okay.
still good.
Nice to see everybody. Sorry I
you,
have
Kate.
to run.
Nope.
Have a good week.
So does that plan
Talk to you
seem reasonable, attainable? Overwhelming?
So this is Patrick. I guess, like, you know, I kind of in similar spot to Kathy where I'm still kind of getting my head wrapped around it a little bit, but it seems like the only thing the council can do is support the municipality itself in terms of direction and policies and substance to training and things like that. So, you know, whether Generations or UCFS has things in place, I don't know that that's relevant to what the council's decision-making will be. So that's why I thought the questions would be really specific to certain agencies to be able to determine, yes, I have a policy on that. Yes, I need training on that. No, I don't implement a specific policy on that, but I would like to. That piece of it. So it almost seems like it's two different things. One is like an assessment of where we're at, but the other is an assessment of who has what things already in place in the community that could potentially be shared with those departments that don't have it. So those departments that are more robust, have been doing this work for a long time, may be able to provide support to other departments and agencies that haven't done that type of work. But I'm not sure that the councils, I just want to make sure that everybody's not getting the same survey and it's of value to one and maybe not of the same level of value to the other, or the data that's generated doesn't really give the council the information they need to make decisions. So I guess maybe looking to Sheila, do you think that the document we have here is going to give them the information they need to be able to have decision-making in the future?
The newest
So,
question.
I know you're saying council, I'm going to say to Bob, again, the council created the ordinance that created this committee, and they're looking for a report to come back that the city can then address, meaning that the city in its entirety can address these areas that were pointed out and that we're looking at. The council, so certain things like training, what would be helpful if some of you know how much you've spent on training? Because where Bob or the directors are gonna come back and say, to implement just let's just say I call it the 101, just to get it created. It's gonna cost the city $500,000 to implement. Where's that gonna come from? The council's gonna have to appropriate that money. That may be a 2-year process. I'm just giving it out as an example. And then to move to the next step to implement, if you know the city manager and the directors come back and say, okay, it's gonna take us 2 years just to get the foundation laid. And then phase 2 of that is gonna be another 300,000. Okay. At least that's understood, or if there are components, is let's say public works, or let's say police department, fire, or emergency management. Let's say they need a specific type of module or component in there, because their turnover is so much higher than other departments in the city. You're talking life-saving things that they may want to have. They may come back with some recommendations, working with the city manager on how they want to implement a certain area. I'm not gonna try to pull out one. I'm just,
No, I mean, I can see them right now, like when we look at the the 13 points of the resolution, a lot of what we're trying to do with the community health equity plan is address some of these, or at least have a place where some of them are addressed. So for example, Norwich City Council, City Manager develop strategies to dismantle the systemic racism. These strategies shall include access to data to drive equitable policies and review of current policies and practices through a racial equity lens. So by us talking about what we're doing in this arena, that is a review of current policies and practices that's happening in the community to spur the city and city council to really look at what they're doing as well. But they're also going to report into this as well. Even number 3, so in partnership with Uncas Health District, develop a Norwich Health Equity Plan that outlines detailed objectives, measurable goals in which the city will focus on root causes and the inequities and cause disparities in health outcomes for our residents. So when we're looking at what we're doing to do that with our community outreach or direct services, we're talking about what those processes look like to make access, affordability, equity available to those individuals. You know, and it kind of goes through on this too, like there's a lot more, you know, what are the resources that promote good health, including good jobs, access to healthy, affordable food, housing, focus on access to prevention and treatment that is culturally and linguistically competent, develop direct service programs and services to add the negative, to address the negative impact that these inequities have had on specific populations. That's what we talk about in our outreach, in the way that we survey for these needs. So I understand that there might not be, you know, answers for every organization on some of these. And if it doesn't apply to, you know, your specific organization, by all means, you could say, you know, it does not apply, or you could write something in that you think is also valuable in that survey. But I think for most of us, many of those questions, there's going to be something for us to say about them, especially, you know, the FQHCs, health districts, Harvard Healthcare. There's going to be a lot there, I think. Patrick, did that help at all in terms of sort of clarifying that a little bit?
I mean, I think number 3 could be the work as a whole. I mean, developing the plan, I think is the
Yeah, that is the
gems-
work. And that's what we did. We sort of lumped in all the rest of those things into that plan. So through that plan, we're basically going to be touching on all these sort of resolutions. That was like the only way that we could like.
But I guess my thing is I don't want it to be like, well, Generations does it and this one does it and that one does it. So, you know, we already cover it in the community. I think it's kind of understood that a lot of agencies are doing a lot of work in this area, but how does the city then strategize as to how to go forward as a city to do the same work? My biggest fear would be that they'd say it's already being done, so why should we spend time and effort and money into developing a plan that's already being implemented by all of our community partners? Does that make sense?
Yes, it does make sense. And, you know, I think I would question the idea that everyone knows that this work is getting done, because we all know. But I think from what we've heard from a lot of Norwich residents and other individuals is that they're not aware of this work. And I think that's the point where we can really showcase what we've done, you know, in the recent years or since the beginning, like really what we're doing as the landscape is changing. Because I know a lot of us are putting a lot of effort in there. And I think that's one of the key themes that go through the resolutions is access to data and information for all Norwich residents on what is happening. So, you know, we may know what people's policies are in embedding DEIB work within their everyday, but not all Norwich residents understand that. And I don't think I'm not sure that like, even like government understands that either, like our government representatives.
I will tell Patrick, a lot of people know Uncas Health under one umbrella, Patrick. And that is, we need you to come in and do the food inspections.
Yeah.
Okay, and they may know, you know, if there's an outbreak or something, especially because of the pandemic, but some of the other areas that you get involved with, a lot of people aren't aware. And even in this committee, even the sitting council aren't aware of what you do. Because all they hear is that you go out and do inspections, either inspections for restaurants, you know, that's the only part anybody really recites Uncas Health, what you do.
And I think like that goes for a lot of our organizations. A lot of people know the great work that we do, but there's an opportunity for us to really showcase that and show why we were selected to be on this committee, why we're the subject matter experts, how we're sort of moving that forward. As far as the city taking that charge, I think it means a lot if we're putting that information out there for everyone to take a look at. And if they've asked us to do that as subject matter experts, it would be nice if we were still considered when they start to make those decisions, or we had some suggestions. But if you remember, that's kind of the group that Missy and Sheila were taking on. We can put what some of our suggestions would be before that resource appendix underneath the budget equity and legislative advocacy. Like, where do we find money for some of these things? How do we partner for some of these things? What grants exist for some of these things? How could a position from the city of Norwich make things easier for us?
But I guess, Joe, my fear is, so we've said earlier before Sheila came that this report is essentially us completing our work and giving it to the council. So if the council doesn't know these things already, or if the community doesn't understand what we do in these areas, is there any expectation that they're going to take this document and then be able to find ways to be able to implement this plan? Or is this just a starting point for the group? I mean, I guess that's where I'm at.
No, I can speak for me and some of my colleagues. I'm telling you that this will be taken very serious. And to the point when I'll even go to the state level. I mean, we know we're going to need our state senator and state reps to also be a partner in this. So it's, it's not just us. I guess that's what I'm trying to dispel, that the city council has some magic that we're going to do. That's not going to happen. But this report will be taken very serious, and there will be opportunities for us, for the city folks who are not at the table, to be able to look at it and say, this is something we've thought about. Sort of the kind of the meeting that Bob and I were just at, like, we got to this point handling this, didn't really know how to handle the next part of it. I mean, that's a lot of what I find talking to department people is they want to know how to move something to the next step and the final step, but they just may not have had the resources,
Right.
or something may not have happened for anybody to think about it. You guys, your agencies normally have dealt with things that government has lagged behind.
Mhm.
So, but I'm telling you, government is slowly catching up with what's going on out in the industry.
And I see your hand up, Missy. I'm just gonna say one quick thing. So also, when we first started this, all committee members thought that it's not our responsibility to implement this on behalf of the city of Norwich. And so I think that's something we also have to think about. So if the health equity plan does not signal the end of our work as a committee, and this committee is interested in implementing these things and shoring this up and putting it forward, that to me seems outside of the scope of what we're doing all day and every day. But if that's something that committee members are interested in, I mean, that would be a likely response. But I think all of us sort of said, it's our responsibility to talk about the work that we're doing, to share how we've been successful, to share how we're partnering, to, trumpet the need for these kinds of resources. But it is not within our power nor our scope to create these things for the city of Norwich and to put them in place for the city of Norwich. So I think we have to be careful about that, because we could say, we don't want to do this plan without action, but very quickly it could be like, okay, well then what kind of action will you take? Go ahead, Missy. I see you.
Yeah, that kind of leads to part of what I was going to ask. So the reference to the Norwich Health Equity Plan, is our final report seen as the health equity plan? And if it isn't, then who is drafting the health equity plan, which I assume is something that gives them very specific recommendations after assessing what each city department should or shouldn't be working on, how to achieve improved health equity after having looked at I don't see our final report as their health equity plan. that feels to me like the next step the city would take. But in here, when I look at the resolution, it says this, that the city in partnership with Uncas, and maybe that's something Patrick's working on with them offline, and I don't know that. But, so I think there's just some confusion there. How does our report translate into them getting a health equity plan? Because
Right.
that sounds like a document that's telling them what they're gonna be doing over X period of time in different strategies to approach the problems that are identified.
So I think that's a really good point. If you remember when we had a Representative Wilson here, he really clarified that the resolution was not supposed to be spelled out in terms of things that we needed to complete exactly how they were, but merely as suggestions for topics and conversations on which we should think about working on.
Yeah, I'm sorry, I missed that, so I didn't know that.
Oh, no.
Yeah.
So he explained that that's why there were so many resolutions, that they were so lengthy and involved, because they wanted to paint with a broad brush and not turn it into a checkbox type of a scenario. So the way that we
Okay.
looked at it is the only way that we could come close to addressing a lot of these was to create a health equity plan that gives us sort of an overview of everything that's going on and makes some valuable suggestions and information for the city and for ourselves to take that information and kind of put that into place. Now, whether they're gonna turn around and say, we want to see measurable objectives with this, we want to move this forward in a certain way, I think that's work outside and above this committee. I don't think it's for us to do in this space, but really, we've taken something that is gigantic and put it into something that we know that we can manage, and I think will be profitable in many ways. Is it going to be the ultimate answer? And is it going to get us health equity within Norwich through this one action that we do? No, but it's the start of us being able to have these conversations, to be a united front, to share our information, our experiences within this space, and be encouraging to individuals who want to go in that space as well. I'm also looking forward to it as a reflection for what I do, to see what other individuals are doing as well, and if there are other possible ways that we can partner more than what we're doing now. So those are the wins that I take from it. But really great question on that, Missy.
Dr. McLean has his hand up.
Dr. McLean, I see your hand. Oh, maybe not. Oh, no, it's just my mouse. I
No,
apologize.
yeah, I was to say, sorry, I didn't
Well,
realize.
that's quite all right.
Does the city, can I ask, does the city already have anyone on contract as a consultant or employed directly who is focused on any of these topics?
I don't believe so.
Okay.
Can you answer that question?
I'm not aware of it. No,
Thank you.
I don't believe we do, but I'm not positive.
And if you remember back to when
We first got
Kevin
started.
came and we talked about cannabis dollars and we talked about those kinds of ideas, and I think, Patrick, you were really, there was a lot of great things that you brought up in terms of saying, like, is there an opportunity for consultant at the city level with this kind of thing? Like, I remember you using the example of when there was a grant, we had an individual who would go to each organization to say, hey, do you have this info? Do you have this info? Would coordinate and put that together. That could be an opportunity funded through cannabis dollars or other dollars to really have that central vein of health equity between all of that. Because as much as I'm pretty sure we all do similar things, it's nice to have a thread that sort of ties it together. So that could be something in the equity and legislative advocacy section that we recommend. This is a great conversation. Other ideas, questions, clarifications?
Joe, it's Mohammed. Just a quick question, clarification. Is having a health equity plan for the city, is that beyond the scope of this committee or is it within the scope?
I think it's within the scope. I think it's going to be basically the only way, and this is, I brought this up before, that we're going to come close to touching on and addressing points in the resolution in a way that we can actually be actionable about it. Otherwise, I think it would be just really piecemeal on how we would start to even begin with some of these. How about the questions? Because we gotta ask the questions to get the info. Is there any, do we like the new revised questions? There's less of them. I know that helps us. Missy, to your point, do you think that we should have even less? Is there too much now that we're thinking about how to synthesize this into a final product? Are we overwhelming ourselves?
So, I'm just gonna be really forthcoming and say, when I worked with Sheila on ours, which is budget equity and legislative, and I looked at other people's questions, I was not coherent on the thought that we were gonna be doing these surveys ourselves. I thought this was a survey being made for the city to
Yeah.
use as a guide to review all the departments and decide and assess where they were at. So I had lost something in translation that it was something we were gonna do. That's fine, we can do it, but I have to say, we're probably gonna have to minimize our answers down, because literally we could write pages on some of the, and have,
Okay.
and grants and federal reports and all of that. So it's overwhelming to look at for us at our particular location, our organization, because of all our work in these different areas, and what we're required to do and is our mission. It literally would be just a really lengthy dissertation, and I'm not interested in doing that. So I'm just gonna really have to minimize our answers to be somewhat helpful and answer the question and represent us, but not in just a really laborious project.
I agree
And that's
100%.
just me being really transparent. I'm sorry,
Well,
but
if I'm transparent, I'm kind of having the buyer's remorse myself, because there's
yeah,
a lot
this
that
is
we
a
do.
lot.
And like, I'm looking at it not only from a department level, but then a hospital level and a regional level and a
Yeah.
system level. So do I talk about what
Yeah.
hospital healthcare as a healthcare system does in this space? Like, so that's going to be really hard for me to be able to pick and choose from that. But I
Mhm.
think your logic makes a lot of sense when we start talking about, can we really whittle it down to City of Norwich practices? Can we keep things very succinct in terms of what that looks like? More high level information, to the information that Bob was talking about or Sheila was talking about, that would be helpful. And if we have certain questions as we're going through there that need clarification so that we can all be on the same page, I'll definitely entertain that. I think that's a good opportunity for all of us, because it can be pretty overwhelming, some of these.
And I don't think there's anything, and Bob, you could correct me if but I don't think there would be anything wrong with saying, if this is an area you want more information.
Yes.
Like, instead of trying to do it for every question, there may be somewhere the city comes back and says, wow, what Generations is doing is, that area is something we'd like to know more about.
Yeah.
And then they could follow up.
Right. They can get into the process.
Yeah,
into the weeds a little bit.
as the committee, I think that should just be a natural page in whatever report we're done with that says, if you want to follow up with any of the organizations who indicated these answers, et cetera, this is
Here
who
to
to
come.
contact, because
Exactly.
then they're bridging relationships with all of us to sit and chew through. Hey, you said you have a way to track your hiring practices. We need a better way to do that. Can you walk us through what yours looks like? Or come talk to the committee about workforce, and answer and talk about those questions. I think making the bridge for all those relationships and offering up all of our personnel who have history and experience in some of these items is a natural and should come out of this anyway. So I think that should absolutely be in the report, and just so much easier than writing books to answer some of these questions.
I agree. I agree with
Yeah.
you. So it should be about like what's being done, not the process. The process looks out the other way. So I think about it in terms of outreach too. So what kind of outreach do you engage in? We don't need to know how you do that outreach or all the materials or the budget or all those other things. It's just high level. What does outreach look like? Are you
Mhm.
doing outreach? How consistent is it? Right. And then
Yeah.
if people are interested in saying, well, how do I throw a health fair? How do I create an initiative around heart and vascular? Like, then you can call me and we'll go into the processes about it. But those parts don't need to be published in the report. Does that make sense?
Well, and Joe, this is Patrick. I think my thought too was, if they're not going to hire a contractor to take this data and make it into something, then you want to have a program that could probably do it as much as it possibly can for the group, I would think. So that's where, having something with drop downs that say, yes, we do, and then have a narrative below it if you want to add more information, but somewhere where you're not compiling the data I heard you and Kate saying it sounds like it would be the two of you doing that work. And that
To
sounds like
start,
a lot of
we would
work for
enlist other
someone.
individuals, but anyone who is interested is more than happy to volunteer.
I just think if you can have it compile the data or information for you as much as possible to give you that initial draft might be helpful. I don't know.
Well, we're using that survey tool digitally because we're trying to make it easy for access for you to share within your organizations. So I don't know what the limitations of that tool is, but we could see how that kind of goes. The thing that's going to save us is the categories, and that's kind of why we had subcommittees in the same way. And it might even be a situation if the information is really overwhelming, where we all take a stab at just kind of like summarizing what comes out of those categories, which might be helpful. But yes, more on that once we get some of the data and kind of figure it out. But I'm glad that we're talking about the product while we're engaging in the process, because that's important. So just to repeat back, make sure we're on the same page. I know we're running out of time here. The new questions look good. They're not duplicative in any way. We tried to take patient stuff out as much as we possibly could. We've scaled them down. And for individuals and organizations that are answering them, and they seem like there is a lot there, happy to talk about how we clarify that. But really, we're looking for greatest hits. So really high level on these things, not like the intricacies of how the process looks like, but really like the overall, what are you doing? How is this information going to be impactful to share with, City of Norwich, directors, other individuals, so that they can get a sense of, hey, this is what's going on. And if they need to drill down and get more connected to individuals, they can. That would be sort of our guidance in answering the questions. Is that good clarification? Is that okay for everybody?
Sure.
Silence means yes.
I think that's where we're at.
Yes,
Yeah.
Sounds like that's where we're at.
Yeah.
thank you.
So this is January. Do you want to do the Thursday or the Friday of the week before?
So the 23rd or the 24th of January, does that sound reasonable for individuals to get this information in?
It does for me.
Okay. Kathy, that sounds good to you? Yep.
It's fine.
Okay.
23rd.
Patrick, that sounds good for you?
The 24th of January.
Yes.
Do the 24th of January. Dr. Wally, that's good for you? Dr. McLean, Dr.
Yep.
Yep,
Okay.
it's good, it's
Almost
good.
3 months.
All right, that's 3 months. So 3 months, get this data together, gives us 2 months to compile, write, create a presentation. In April, we may see some light at the end of the tunnel. That makes sense.
Can I just ask one thing?
Sure.
As I'm looking at the questions, one question is about the community health. Do we have a community health improvement plan? Our answer to that is the library is going to look very different from a health field. So just as long as that's understood. And then just one thing, I wonder if we could just change the word, because I don't want to offend anyone. In the impactful learning and professional development, the first one is, what does your organization do to increase the percentage of people of color working quality jobs? It can be very offensive to some people, just calling something a quality job. Could we
Yeah, that wording.
define that better,
Not in the
perhaps?
questions we submitted.
Okay.
Yeah, as a subgroup. Got somehow it morphed into that.
How do we want to change it? What does your organization do to increase the percentage of people of color working quality jobs and or increase their level of educational attainment?
I think we need to be careful. There's subjectivity in that. All of our jobs are meaningful.
Correct.
Contribute. It doesn't matter what we do. So maybe you just leave it at jobs. I would agree. Then
Percentage
without the
of
word
people
quality.
of color employed.
Yes, I like that better. Yeah.
Thank you.
I'll read it.
What does your organization do to increase the percentage of people of color employed or increase their level of educational attainment?
Okay. I mean, if I'm employed is better than quality, just to the point. Yeah.
I think the original basis behind that was to make sure that there were jobs and different levels of leadership, different levels of professionalism, and not just entry-level jobs. for individuals who are people of color.
I understood it that way,
Sure.
but I just think anybody reading it, that could be offensive to somebody.
No, I get it. I understand.
Yeah.
You guys are the experts in that.
Yeah,
I
we
think
need to
that's
be
just how it
careful there. I
goes.
think we should.
So
Enjoy.
just to offer another phrase, our goal is to have the representation of all applicants by race, ethnicity, all of the demographic groups are representative of the communities we operate in.
I like that.
So that's just a very objective, I'm sorry, I forgot the word minimally represent. So that's just by proportion, basically. So that you're not having misrepresentation wherever you are. We have different locations in different regions.
Right, okay. So
Should
my
it, should the
que-
goal be to improve the representation so that the representation of those employed better matches the diverse representation of city residents? Because I
That's
think
what I'm saying, that the goal is to
Not
at
to
least
match it.
minimally meet the representation, represent
what's minimally
equitably
reasonable?
of what you have. But if you want to say more than, is higher. Because
I
you're
think the
trying
goal
to,
should always be to strive to increase the representation, the percentage of those employed to meet the representation, the percentages of the city residents, but we're never going to achieve that. I think that's an unrealistic goal, but it's a good goal to strive to do better or to improve those percentages.
To reflect what of the city's residents, the demographic
The
makeup,
diversity of the city's residents, is that,
Yeah. No, go ahead, right. Okay.
maybe see how that reads
Well,
and then get some input.
I will say to you that, and those of you who lead your organizations know that that's accomplished when leadership makes it a priority of the organization. So the words on paper don't mean anything until leadership makes it a priority within the organization to achieve that.
right,
But I
Well,
think words are very powerful. So I don't think we should be misleading because we're providing information to the council.
Right, no, I'm not trying
Yeah.
to, no, I'm not, that's
Yeah.
why I told him, write what you said,
Mhm.
I'm just saying. It is all achievable when leadership dictates that they want their agency or department to reflect the demographics of the community they represent. And until that happens, it's never gonna be achieved.
I just want to
That's
read this.
I would reword that to say.
I'm just going to read this right here
Yeah,
and
go
see
ahead.
what you say. So what does your organization do to increase the representation of those employed to reflect the diversity of the city's residents?
Yeah, see what the group thinks. I think it's.
What do you think about
yeah,
Better.
that's
like
pretty
that.
much what we do.
You
Yeah.
want it
that's
again?
better.
What does your organization do to increase the representation of those employed to reflect the diversity of the city's residents?
I like that.
Right,
Winner.
and then Sheila's point is about putting it into action,
Yes, that's all I wasn't
Yeah.
trying to change.
but that's the, yeah.
I still think we need to be careful though, to think about whether it's unrealistic to think that just because there's the will politically by council to mandate it, that it is achievable, all achievable, because those were the words used. I think it's more achievable. I definitely believe it's more achievable if you have council backing.
Oh, yeah,
Yeah.
no, I wasn't even trying to put this on the political.
Yeah, no, this is just asking, what do you do about it?
Yeah, it was an action, and my
Okay.
whole thing is just, when you put it into action, when people believe it from top to bottom,
Mhm.
not political, you'll find out for me.
Yeah, no, I'm just saying that I was
political-
responding to the, it's
Yeah.
all achievable, that's all.
No, all I mean, yeah, but.
I understand what you're
Yeah,
saying, what
okay,
you're clarifying, thank you.
You're welcome.
So,
Okay.
so we're good with questions, right? So I'll make this last change, but everyone else is okay with the questions as they're represented in the last edit. So I'll make this, have Kate make this last change and we'll send out the survey again. And then it's time to start distributing them within your agency to get that information by January 24th. And it is currently 3:32. We started at 2:33. So I will entertain a motion to adjourn.
Motion to adjourn.
Sheila, second, please.
Second,
Second.
Kathy Special, all those in favor?
Uh,
Aye.
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 So move. We are adjourned. I appreciate all of the robust conversation today, folks, and all of your